A number of health studies through the years have revealed the negative impact smoking can have on our bodies. But is that the same for vaping? As a part of our Ask the Expert series, 7 News anchor Kelsey O'Donnell spoke with a doctor from Bon Secours about the difference between cigarettes and vaping.
I would advise to not inhale anything on a regular basis.
Bon Secours Dr. Nathaniel Phillips specializes in pulmonary and critical care.
That would be my number one advice. If you're smoking, we know that there's really overt data that says you should stop, and that's one of the best things you can do for your health.
Dr. Phillips says he's seen a number of patients experience the pitfalls from smoking cigarettes, including cancer. And now the newer, less studied vaping is raising concern.
We really don't know a lot of the long-term things that are going to be associated with that. It seems that there is some harm reduction compared to traditional smoking. That doesn't mean that it's safe or not dangerous. I think we just don't know.
According to the American Heart Association, the increase in vaping in recent years has turned into a serious public health threat, not only for adults, but for kids too. Some experts say vaping was first created as a way to decrease the use of cigarettes. But medical professionals like Dr. Phillips say there are still many unknowns, including the long-term impact of the chemicals within the device and the addictive nature of nicotine.
We know that cigarettes are tied to cancer. You can get all sorts of cancer, mouth cancer, head and neck cancer, lung cancer, bladder cancer, all kinds of cancer from smoking. And yet we don't know if vaping has that, at least that link has not been established, although there's still things like carcinogens, heavy metals, and other things that are found in vape or vaping products.
Regardless of what you're inhaling, doctors say you should work towards stopping to improve your overall health. Because the sooner you quit, medical professionals say you'll dramatically lower the risk of certain cancers and diseases.
You'll see some changes in a very short amount of time. Within a few years of quitting smoking, you actually substantially reduce your risk of certain things like heart disease, or normalize or get closer to sort of the general population.
For this week's Ask the Expert, I'm Kelsey O'Donnell.
If you need help stopping, whether that be quitting cigarettes or vaping, doctors say to reach out. They can direct you to the best way to cut back and eventually put it down for good. Remember, you can submit a health topic for our Ask the Expert series. Head to our website, click the News tab, then click Ask the Expert.